Yeah, it says recording. Okay.
I mean, you can edit
up there.
Oh, yeah, you can keep looking at it.
Okay, hi Angela, how are you this week?
I'm alright,
Okay.
I guess.
How was your week? How was everything going with your family?
I mean, same old, I guess. I mean, he's been gone for a lot longer than usual.
Your brother, he's been gone?
Yeah, I haven't heard from him in 2 weeks. A couple of days here and there sometimes, normal. I don't really get concerned. I call him, he tells me stop worrying, and I get over it. Because I'm worried, but he blows it off. So as long as he's fine, I don't really care. But it's been 2 weeks.
So how does it make you feel when he doesn't call you for such a long period of time?
I mean, as much as I try to not let it bother me, it bothers me. And I mean, he's normally just laying around the house, which upsets me too. But at least I know that he's fine. Even no matter what he's doing, if he's getting drunk or doing whatever he does with his friends, at least I know if I go home and I see him, he's not dead somewhere that I don't even know. Or if he is out, he'll at least answer his phone normally or send me a text when I, harass him enough. He'll finally respond and say, I'm fine, leave me alone. But he, no response.
Well, when you said it bothers you, how does it must affect you in some way? Has it been affecting you differently lately? Or?
I mean, I guess I'm just worrying so much that I'm not really focusing how I normally focus. And when he's around, it motivates me to just ignore him more and I can focus on my schoolwork and stuff. But recently, I don't know, I got a test back today and I got a B+ on it, which isn't the end of the world. It's fine, but it's not what I normally get on my tests or anything like that. And the only thing that's been different is that he's been gone and I constantly have to worry about where he is because my mother's not really home that often. So she doesn't seem like it doesn't seem anything's out of place to her when she does come home and he's not there. I guess she just assumes that, she's been gone all day. So the one time she's home doesn't mean he's going to be home too. But when, the few times I do see her, I ask her if she's heard from him. It's not out of the norm that she hasn't because she doesn't really check in with either of us. So
you must be feeling lonely that your mother's not home, your brother's not home.
I mean, mom not being home is usual, so I'm not really lonely missing her, and I don't really miss him. He's just a kind of annoyance when he is there. I yell at him, and I feel like it's my job to make him do something. He doesn't do it, but I feel like that's what I have to do.
Do you feel you have control over his actions?
Not really. I mean, I don't want control over his actions. I want him to control it. I don't want to be his mother. I don't want to nag him. I don't want to do those things. But sometimes I feel like he just needs a shove in the right direction. And, he's my big brother, so I don't want to ever feel like, or I don't want him to ever feel like I'm talking down to him or trying to tell him what to do because, most of my life he took care of me and he was good at it. I never had any complaints about how he took care of me. But right now I feel like he wants someone to take care of him and I can't do that for him because then I'll just fall into the same trap he fell into and I don't want that to happen.
But do you feel obligated that you should be taking care of him?
I mean, grandma will take care of him. If something were to happen to him, he's not feeling well, stuff like that, she'll take care of him the same way she was there every once in a while to take care of both of us, me when I was younger, but at the same time, it is just me and him most of the time at home and I'm capable of doing it, but I don't do it because I feel like that just gives him the option to lay around and let someone take care of him. It doesn't, lead him to the point where he thinks, okay, I need to get up and do something for myself. If I keep falling into that trap, then he'll never get to that point. I don't want that to happen, but I also don't want him gone for 2 weeks and me not know where he is, what he's doing, or who he's with, if he's okay, if he's not okay. That doesn't, I don't know, I don't want to take care of him, but I don't want to just not know where he is either. I don't want him to disappear.
Well, does your grandmother know where he is when he disappears like this?
I asked her, she said no. A couple days, she'll worry even when it's a couple days and I'm the one who has to go. It's fine. Like I already spoke to him. He's, he's out with his friends. Don't worry about him. But 2 weeks with neither of us hearing from him is not normal. And I know that's what made me get my bad test grade. And that's upsetting me even more because I swore that I would never let anything that went on at home affect what I was doing with my life and make sure that I always finished school, and now it's affecting it. So there's nothing for me to do about that. I don't know.
Yeah. Have you seen your grandmother at all?
I saw her once in the past 2 weeks. I don't see her now that he's not there because, he's not picking her up, taking her to her doctor's appointments and stuff, but.
Right, because I know one of the last times we spoke that your grandmother's going to try to incorporate you more into taking her places. Has she done that? Or?
Not really. I mean, no. I saw her the one time she came over, she was looking for him. I told her he wasn't there, and then I asked her if she'd heard from him and she hadn't. That's why she'd come over to look for him. But I mean, no, she
Could
hasn't
I
really.
ask you, how do you feel about your grandmother's and your brother's relationship?
I'm happy that she takes care of him, but it upsets me because she takes care of him. I don't think she realizes how much he depends on her and how much he thinks no matter what he does, he'll always have that sort of backup plan in her. And she's just, I don't want to be upset because it's just her being caring and being a grandmother, like anyone's grandmother would do. But she doesn't really realize how much, like, sometimes I feel like he's taking advantage of her and she doesn't even realize it. And then sometimes I feel like she does realize it and that's what she wants because, she gets whatever it is that she gets out of, him depending on her like that, she wants that to happen. So.
And what do you think she gets out of him depending on him?
I mean, to the world, it's just like, oh, he takes her to the doctor's office, stuff like that. But she's capable of doing those things on her own. So it's not like it wouldn't happen if he didn't take her, or even if I was the one who had to take her. It's not like she wouldn't be able to get there any other way. So I know that he has pains and things like that, and he needs his medications, but I just feel like there's something going on with her medications also ending up in his little groupings of pills and things like that, and his friends when they hang out together and stuff like that. And I think that's sort of the dependency that he has on her. And then that it just means that she has someone that also does it with her. So I feel like that's just what's going on between them. But they don't think anyone else really knows.
All right, so what you're saying is that you suspect that they're sharing their medication and their drugs together?
Basically, yeah. And I don't know if it's all the time or if it's just sometimes, but that has to be what's going on. Like, there's no other explanation for him. Her seeing so many doctors. He had surgery, so he actually has problems, and he goes to see his regular doctor and different specialists and surgeons and things like that. She goes around to all these different doctors. She doesn't really have any great ailments. She's older, so she has the usual, she needs to see her doctor more often. She has some medications that she's supposed to take, but there's no need for her to be going to all the different doctors that she goes to. And it just so happens that my brother, who I'm pretty sure is dependent on, like pain pills and stuff like that, is the one who takes her to see all these doctors and get all these different prescriptions.
And how does it make you feel, though, that them two are kind of in cahoots together and you're the odd man out?
I mean, I'd rather not be in cahoots with them if they're drug addicts. Like, that's not what I want to be associated with. But at the same time, I don't know, sometimes I feel like if I did get more involved, then I could stop it from happening. But
so in a way, you feel like if you got more involved, you can stop it from happening. So you feel that in a way you could have control over the situation? I
could, but it's just, I don't know. I mean, maybe I'm just too weak to. Sometimes I feel like if I were to get involved, I would fall down the rabbit hole with them, and I wouldn't really, be able to help them because I would just end up with a problem as well, which is why I stay away from it. But I mean, I don't know. Maybe there is more that I could do, and I'm just too scared to do it.
Well, I would suggest you to try an Al-Anon meeting. Do you know what Al-Anon is?
No, I don't know what that is.
Well, and actually, Al-Anon, it's for families it's for family members I can't. It's almost over. It's a social meeting group where people come together to discuss the problems that they're dealing with their loved ones who are either on alcohol or abused on drugs. I think if you go there, you might be able to hear similar stories, and you could identify with the other people there, and you might be able to pick up some techniques to help you, because it seems that this is starting to affect you. It's affecting your schoolwork and now.
I mean, yeah, it is, but why should I have to go somewhere to get help with something that's not really my problem? I mean,
but it is
I
your
feel
problem.
like I'll
You're part of the
get over
family,
it.
and within this family there is a problem, and it's affecting you. So it's
but
your problem also.
They won't even admit to their own problem. They don't think anyone knows what they're doing, or
well, they're in denial. That's part of the addiction.
I guess so.
Yeah. Okay, rough.
I'm trying to talk as much as I possibly could.